Good afternoon. Today we're going to talk about pregnancy, conceptions, your trimesters, and what to expect when you bring your child home. I have 2 children of myself. I have one boy who is 2 and one girl who is 1. Okay? So in the beginning, you're going to plan whether you are ready to have a baby or not. This is a very important step. Of course, we're not going to talk about how conception happens because I'm pretty sure everybody knows how it happens. We need to see whether or not a person is financially able to take care of a child. With that being said, whether their spouse is mentally prepared as well. Also, when we go to talk about conceiving, there are women who cannot conceive naturally. These women will seek help of other medical professionals. Fertility clinics mainly. There is IVF and artificial insemination. Artificial insemination is when the doctor will insert the sperm directly into the woman's cervix. IVF is where a doctor will extract the eggs and the sperm, and they will put it together and then insert the sperm egg back into the female cervix. This is the most common method, although there is sometimes that it doesn't take, and it is fairly expensive. Okay, once you have achieved conception, it's time to take a test. We all know that there's tons of different brands, different readings. You've got the digital, you got the plus or minus, and all that. That is what you take when you have missed your period. But the best method to find out whether you are pregnant or not is a blood test from the doctor. It will give you a definite yes or no answer. Okay, you're pregnant. Yay, congratulations. Okay, you are in your first trimester. Your first trimester starts from the time of your missed period until about week 12. This is when you're going to experience a lot of bodily changes. You're going to have to give up some of the food you like, mainly fish. You can eat it in moderation, but they recommend you don't eat it. Caffeine, if you are a smoker, no alcohol. And you're also, most moms experience morning sickness, which is terrible. I didn't have it with my son, but I had it with my daughter. Terrible. You're going to go through your first set of doctor's appointments. You're going to have your blood work drawn. You're going to get to see the baby if you're far enough along. The doctor's going to give you a whole bunch of packets and information telling you what you can and cannot have, what medicines you can take, and all of that. So that appointment is very, very, very crucial in the beginning of your pregnancy. Morning sickness, there are tests now that you can find out what the gender of your baby is in your first trimester. It's a blood test instead of waiting on the actual ultrasound test. Okay, so you've breezed by your first trimester, you're in your second trimester. That's about week 13 to week 27. And this is one of the most exciting trimesters. You do get to feel the baby start moving. You actually get to see your bump so people don't think you're just fat. I've had that question a lot. Are you pregnant or are you fat? No, I'm pregnant. But you get to find out the gender of your baby. Most baby showers come around the beginning of the third trimester. So you're planning for that. You're getting excited. Third trimester. It is go time. You are mentally preparing. You're getting your last minute things. You are doing everything you need to make sure that your child will be here successfully. You're going to the doctors every week, every week, every week. Sometimes they will check you per your request to see how far you are dilated, if you're dilated any. Sometimes they will sweep your membranes, which is a very unpleasant feeling. But the third trimester feels like it's going on forever. And sometimes, to prepare your body for labor, you will feel Braxton Hicks contractions, which sometimes can even happen in your second trimester. Doctors around here in the Bluefield area will allow their patients to have the option of being induced. Now, with being induced, there are risks of needing a potential C-section, since you are forcing your body to go into labor instead of waiting until you actually go into labor at home, if you so choose. Most childbirths happen at hospitals, but there are some home water births, and for that you will need a doula and a midwife. They will come and they will talk you through birthing your child at home. There is no medication for that. At the hospital, you have the option of a Stadol shot if you are planning on going naturally, or you can have the epidural, which is medication injected into the vertebral column of your spine. Now, if you have to have a C-section, you have to have a spinal tap, and that will completely numb you from your chest to your feet. It honestly feels like you are suffocating because it feels like you cannot breathe. And they will insert, it's a longer needle that goes into your spinal column that helps numb you. I had 2 C-sections. My first was an emergency. My second was a planned. There are some mothers that will try to have a VBAC, which is a vaginal birth after cesarean. Hospitals around here do not have it because it is such a high risk labor. There are tons of times that complications go wrong and then they have to need an emergency C-section. Advice for C-section patients. Now, according to Fit Pregnancy, make sure that you take all the medication that is prescribed to you. Don't wait until you start hurting to take it. Take it on a schedule. With my son, I did not take anything, and I was in the worst pain of my life. With my daughter, I took it, and it was so much better. If you have multiple pregnancies and need multiple C-sections, your second C-section is always better than your first because you know what to expect. Okay. You've been pregnant, you've given birth, now it's time to bring your baby home. This is when the real panic starts to set in. Congratulations. Many people think they're prepared for pregnancies and bringing their babies home, but they aren't really prepared until they bring them home. The nurses help you in the hospital, and then when you get home, you're completely on your own. But one thing that mothers need to realize is always accept help. Always accept help. Otherwise, you're going to go crazy. That's plain and simple. You're going to go crazy. Don't get down on yourself. You can do this. I believe in you. You got it. Thank you.